Alderneys Key FM.
As you guessed, I've just spoken to Dr. Julie, and I'm hopefully on the line is our President, William Tate. Good morning, William.
Good morning to you, Dougal, and good morning to everybody out there.
Yes, so you've got updates for us, William?
Yeah, I shall crack on. Firstly, can I say Dr. Julie has chosen to stay and support us.
Yes.
I wouldn't want anybody to think that it was being imposed upon her. So it's a massive thank you. She's an integral part of the team. She really tells it like it is. And I think we all have a responsibility to listen very carefully to her words of wisdom.
Yes, indeed.
Okay, so here we go. Well, it's been a busy and eventful weekend, as you will appreciate, and I'd like to start, as usual, by bringing everyone up to date with the latest testing figures for COVID-19. There have now been 45 positive cases of COVID-19 identified in the bailiwick, all of which continue to be located on the island of Guernsey, and they are still awaiting test results for 32 people. The vast majority of these positive cases continue to be as a result of the individuals having travelled recently to somewhere where COVID-19 is spreading through the community. The transmission of the virus widely within the Guernsey community is not currently evidenced. The situation in Alderney continues to be that we have no confirmed cases. Outstanding test results from Alderney are being returned and as of yesterday have been negative so far. As I have previously said, this does not mean the virus isn't here and we should continue to behave as if it is and observe the rules about self-isolation and social distancing. And I think that it's incredibly important to reiterate the warning that Dr. Julie has just given, that unfortunately there is an unusually high number of false negatives around testing for the coronavirus. So what that means is that despite the test appearing negative, in 30% of cases, in certain circumstances, that may not turn out to be the case. So that's something else which we should be very aware of, and something else which reinforces to all of us how important it is to observe the social distancing principles and to stay at home. Now, there's been a lot of misunderstandings and confusion around the last lot of guidance that was issued by Guernsey. And I did say on Friday that in relation to certain matters which concerned us here, there were discussions going on over the weekend in which we played our part, and as a consequence, new revised guidance was issued yesterday afternoon, and it now draws a much clearer line around those businesses which are defined as essential. It emphasises that the public health objective is to minimise contacts between households as far as possible so we can reduce the rate of transmission of the virus. The core instruction is stay at home, other than for exercising, to buy necessary food and supplies, for medical appointments, or to work where that work has been defined as essential. Now, I'm going to read parts of the media release that was published yesterday because not everybody in our community has access to the internet. And in fact, I received a call yesterday afternoon from somebody thanking us for these broadcasts because they did not have access to the internet, but they were being able to be kept up to date with all the relevant information. And that was one of the principal reasons why we decided on this strategy, because despite most of us having access, there are still some people who need to get their message in the old-fashioned way of sitting listening to the radio. So the media release goes as follows. New guidance for businesses and workers has been issued, which supersedes all previous guidance given and supports the key message that in order to protect our community, islanders should, apart from specific reasons, stay at home. Now, this guidance applies equally to us. So the guidance is in respect of the bailiwick, and I will come back to that later. But for the purposes of the press release, all this information applies to us. These restrictions were originally announced on Tuesday and came into force on Wednesday after the Director of Public Health confirmed community seeding of the coronavirus was taking place in Guernsey. This marked a definitive need to deliver the island strategy and bring in further measures mitigating the spread of the virus. And for those who don't know what seeding is, that's when the virus is spreading within a community and cannot be isolated to a person who brought it into the community who has been tested. So that's where the worry is, because it makes it much harder to track each person and to limit the extent of the spread of the virus. So that's why the message is, and I say again, stay at home. So this new guidance has several significant amendments, including the removal of the following businesses from the list of those permitted to open: boat, vehicle and bike repairs, apart from emergency vehicle repairs for essential workers, retail hardware stores, retail sellers of office products, retail sellers of IT equipment, restaurants, cafes, takeaway and kiosks. So those businesses have been removed from the list. Retailers selling animal feed are permitted to remain open, but must adhere to the strict social distancing guidance and hygiene guidelines. Outdoor trades will only be permitted to provide critical or emergency repairs and maintenance, and businesses such as gardeners, window cleaners and domestic cleaners should cease trading with immediate effect. Those businesses still permitted to have workers on their premises must do so following the strict guidance limiting the number of workers on site to no more than 2, and assuring that they take measures to observe social distancing and adhere to strict hygiene guidelines. The guidance for individuals remains unchanged. They should only leave their homes for necessary food, medicines and supplies, for medical appointments, to exercise, or to travel to work where that work is designated as essential. Deputy Gavin St. Pierre, the chair of the Civil Contingencies Authority, said, "Our message remains the same. Stay at home. We must lock down at this critical time to slow the spread of the coronavirus and protect our health infrastructure from being overwhelmed." Clearly, since making our announcement, there have been many questions and many people asking for clarity on what this means for their specific circumstances. As I said in my open letter last night, the government has worked incredibly hard to give that clarity quickly. But it has not been straightforward, and we know it's far from perfect. It isn't going to be perfect. We don't need it to be perfect, but we do need it to work. We know our original guidance issued on Friday evening was not clear enough and not strict enough in limiting those workplaces which should be allowed to open. We have quickly reviewed the position, which has led to the new guidance we are releasing now. It is better, but we're acutely aware it cannot cover every eventuality and will include decisions not all will agree with. We're asking islanders to stay with us, to work with us, and to remember the point of all this. We must slow the spread of the coronavirus by reducing unnecessary physical contact. We need you to make sure that's what happens and not seek to bend the rules or push the boundaries. Tougher restrictions are an option that is absolutely on the table, and we will use them if we have any doubt that people are following these measures. Deputy Heidi Soulsby, the President of the Committee for Health and Social Care, said, "We are ready to make decisions that aren't popular in the interests of our community, but in fact, as we've already introduced restrictions to protect public health and our health infrastructure, we've been hugely encouraged by the support we've seen by most in the community. We don't want our message to be muddied or misunderstood. People must stay at home and stay away from others who are not members of their household as much as possible. The exceptions must be for exceptional reasons. We are doing things in hours and days that would ordinarily take government months to consult on and produce, and with no template to work on. However, thanks to a lot of hard work over the weekend, we believe that the new guidance provides the clarity that is needed. Thanks to the overwhelming support of Islanders, we have already bought enough time for significant preparations to be made at the Prince Elizabeth Hospital in anticipation of more cases and those needing greater care. But we must continue to do everything we can to slow the spread and to keep the pressure off our acute services and our front-line healthcare workers." Dr. Nicola Brink, the Director of Public Health, said, "This is a critical time in our response to the coronavirus. Everyone has a duty to ensure they do as much as possible to minimize their interactions with other people outside their household. These restrictions are a big part of ensuring that happens. But even where the restrictions don't explicitly prohibit you from doing something that means you'll be physically close to other people, you should not do it unless absolutely essential. For example, while food retailers are open so you can get essential supplies, you should limit your shopping trips to as few as you can. Don't pop into the shop every day for a few extra bits. Our response to this virus as an island depends on each of us taking extreme care and making sensible, health-focused choices." So that could not be any clearer. And we certainly subscribe to everything that has been set out by Gavin St. Pierre, Heidi Soulsby and Dr. Brink. And what I would like to re-emphasize is that all of those who are dealing with this crisis don't have a book of what to do. As it's been pointed out, decisions are being made in real time, and that will inevitably lead to situations where we can look back and say, well, perhaps we could have done that better. We are all doing our best. So the revised rules as they apply to us. You cannot operate from business premises if you are one of the following: licensed premises, pubs and clubs, takeaway food premises, beach and other kiosks, of course, which we don't have, cinemas and theatres that we don't have, restaurants and cafes, retail outlets other than essential retail outlets, which I will come back to shortly, libraries, community and youth centres, car, boat and bicycle repairs other than to repair vehicles for essential workers. Outdoor trades, again, I'll come back to this in a moment, community places within parks, places of worship, hotels, guest houses, and any other premises used for the purpose of the provision of sleeping accommodation, board, lodging, or board and lodging for reward, and campsites. So if your business doesn't appear on that list, you can only operate if either work can be done remotely, i.e. from your home, or only 2 people are on the premises at any time, and they maintain strict social distancing. The only exceptions are businesses which have workers who are defined as essential. Even then, social distancing must be observed. Outdoor trades such as gardening, window cleaning, and building are not considered essential and must cease operating. Now that clears up the ambiguities that we were faced with last week, so that now we know that gardening, window cleaning, and building must cease operating. So let me move on to the list of retail businesses which can continue to operate because they are defined as essential. They are retailers of food beverages, including off-licenses and newspapers, retailers of household consumer products necessary for safety and sanitation, pharmacies, fuel stations and heating fuel providers, retail of essential items for the health and welfare of animals, laundries, banks, post office and insurance brokers. Now, it is important to stress that these essential businesses must still abide by strict social distancing and hygiene guidance. And if they are open, they are only open for the sale of essential goods that would normally be found in the types of shop listed above. There is an awful lot of additional information which is provided in the full guidance, which, as always, can be accessed on gov.gg, or in fact the link is on the state's website. One thing that has changed is that takeaway restaurants are no longer permitted to operate. This is not a change that the operational group who are coordinating the response on Ireland supported. They felt that takeaways being delivered in Alderney are safe and serve a social purpose in maintaining some appropriate contact with people. In particular, there are some isolated and vulnerable people who benefit from this service. However, despite our advice, the guidance does not permit this, and the current position is that takeaways must close. If the position changes, we will be the first to let you know. So, we were working over the weekend around this issue, and we had the opportunity to put our case and to ask that our businesses should be allowed to continue. But the decision that was made, which is led by the public health professionals, was that this is a policy which should apply throughout the bailiwick. Now, we are still talking about the issue and how it would affect Alderney, and as and when we have any further information about that, then we will make that available. But we do recognise that these new provisions will cause difficulty. They will cause economic uncertainty. But public health trumps everything. Because if we cannot keep our community safe, if we cannot keep our community healthy, then economics suddenly becomes a very secondary issue. So we'll deal with the economic impact of it. We will make the arrangements that best serve the interests of our business community. But please, everybody who is hurting from this, please recognise that keeping everybody safe and limiting the impact of this pandemic drives every decision that is made, both here and in Guernsey. So, if it really felt like this was a big community effort to keep some sort of normality going around the delivery of meals from our takeaways, and yes, we all share that disappointment, but as I've already said, sometimes decisions have to be made which people find difficult, but I've explained to you as best I can, the reason why those decisions are made. But rest assured, we will continue to fight the case for Alderney. We will continue, wherever possible, to seek some derogation from what is being applied throughout the bailiwick. But please bear in mind that those in Guernsey are responsible for the health of everyone. So that is a discussion which will be ongoing. It has not been forgotten, and please support us around what we're trying to do. Now, I made an appeal on Friday for property that might be empty that the states could use to house essential workers, and also we asked for a range of furniture and other household items in order that we could prepare 2 states' houses for the same purpose. Within 10 minutes, we had received 3 offers of 2-bedroom flats, and later we received an offer of 5 properties of varying sizes, all of which can be used in our communal effort. So it's a really big thank you to everybody who has responded. This has really helped us with some of the key preparations we're making. And this is the sort of community response that keeps the minds of all of us focused. It helps us because it shows that we're all in this together, and that is inspirational. I have to say, by the same token, particularly on social media and people who should know better, there are attempts to undermine the medical advice we are receiving. There are attempts to undermine the role being played by our chief executive, and there are attempts to undermine the role that I am playing. Now, none of us signed up for this, and we're doing our best. And criticising us and not supporting us is not serving anybody. And the medium of social media allows that to go round like wildfire. So when we see things like that, when we hear things like that, that doesn't inspire us to do our best. We cannot challenge ourselves at this time. We have to remain a community focused and determined to fight this battle. So please find something better to do than using social media as a tool to seek to undermine the efforts we're making on your behalf. Please get behind us. Don't stand there trying to micromanage what is a situation which is capable of overwhelming if we don't stay focused and fight this battle. On a different note, the charity shop. I've spoken to Barbara this morning. Although she had hoped that she could keep the charity shop going by taking in donations, unfortunately, logistically, that's not going to be possible. So please, would you not leave your donations in the doorway of the charity shop, because Barbara simply doesn't have the resources at the moment to be able to process it. And of course, it also would pose health risks to anybody who had to sort through it. So that's that. What else do I have to tell you? This is this week's presidential mirror test. So what I'm going to ask people to do is, before going to bed at night, look at yourself in the mirror and ask yourself the question, did I do everything I could today to keep us safe? If we can all do that, and if the answer is yes, we will get through this. Please, everybody, do that test every night, and please look at yourself and be able to say, yes, I've done my bit. Well, Dougal, I think that brings things pretty much up to date. I apologise to the person that I answered the phone to yesterday afternoon naked as I was about to get in the bath. Probably just as well they weren't Skyping me.
William, I do hope you realise this is before the watershed, and that is far too much detail.
It certainly is. You ask my wife, she'll tell you.
No, I believe you. I do believe you. But listen, I must take this opportunity. This really is a difficult time for everybody, and there are people on the front line. And just as an example, I went into the bank the other day because I had to, and those people there said, thank you for mentioning us on the radio, because we're putting ourselves on the front line as well. And there are so many people on the island that are doing that. And we're not doing it because we particularly want to. We're doing it because we have to. Because I said before, early on, that we may have all arrived on different boats, but we're on the same boat now. And we all need to stick together, and that's what will get us through. And listen, people will always moan, but we appreciate everything that is going on. And it's a unique situation for the world, not just for Alderney, but for everywhere. And we don't know how to deal with everything, but we're trying to get through it best as I can, or best as we can collectively. So we thank you very much for that. Just a little message that I think Dr. Julie said just before we spoke to you, William, is about groups congregating together. I don't think it was said that down at the hospital, but I think it was on the way to the hospital that there's still the odd group around that are perhaps sticking together. So we just need to try and sort that out. William, I think that just about covers everything.
Yeah, I think so. Yeah, I mean, again, getting together as a group is a really, really bad idea.
Yep.
Because I think the science is that one person gets it and they pass it on to 2.5 other people. So just do the math on that, and that's a scary prospect. So please, we're doing really well as a community. I mean, the majority of us have embraced this advice, and we respect the advice, and I think we're in a better place than most places in the world in terms of our preparation and the advance notice. But please, finally, the warning signs are all there. Look at Guernsey. Look at the UK. We cannot allow that situation to happen here. And by doing what we've done, we can reduce the chances of that happening. We can control the spread. We can deal with the people who are ill, and we can come through this much, much better than a lot of jurisdictions who haven't, for whatever reason, put in place these precautions early enough so that they are now finding themselves overwhelmed. So, again, a massive thank you to the medicals, a massive thank you to the civil service, and a massive thank you to everybody in the community.
And thank you, William. And I think after all this is finished, and it will finish, I think there's going to be an almighty lot of thank yous to go around to an awful lot of people. So thank you very much. And I'm sure at the moment it will be same time tomorrow morning, 9:15, unless something else happens and we can go live then at any time. So, William, thank you very much indeed.
Okay, I'll see you all tomorrow. And stay safe, everybody, and do the mirror test.
Yeah, thank you very much, William. But can you put your clothes on? Thank you. Thanks, William.
Bye.
Bye.
Alderney's Key FM.